video will present information about safe medication administration, what types of medications are at a high risk for adverse outcomes, such as pinch medications, and what type of education nurses should deliver to their patients. This video can help facilitate safer healthcare, increase the likelihood of medication compliance upon patient discharge, and promote better patient outcomes.
First, before medication administration, the nurse should always check their 5 rights, which are the right patient, right drug, right dose, right time, and right route. Observing the 5 rights is the first step for nurses to ensure patient safety, administering medication to the right patients, and reducing adverse effects or misdosing that could lead to fatalities.
The PINCH meds acronym stands for IV potassium, insulin, narcotics and other sedatives, chemotherapy drugs, and heparin and other anticoagulants. These are drugs that require extra caution and possibly a second nurse check depending on your facility.
First, normal potassium levels are important for cellular functions and cardiac rhythm. Too much or too little may cause problems, and as such, rapid IV administration, while sometimes necessary, can be fatal in the form of critical cardiac arrhythmias.
Next is insulin. This is given to lower blood glucose, but it carries the risk of hyperglycemia. Harmful effects include coma, neurological impairment, or death, so look out for a blood glucose less than 70 milligrams per deciliter, hunger, confusion, and possible loss of consciousness. You can give some candy or orange juice to fix this if they're conscious, or intramuscular glucagon if they're not.
Third, we have narcotics, which are a class of medications commonly used for moderate to severe pain. The most significant safety risks with narcotic administration are respiratory depression and hypertension. Therefore, slower IV administration of at least 30 minutes or more can delay the potential central nervous system depression.
So fourth, we have chemotherapy. These agents work to destroy DNA or stop cell division. This targets both cancerous and healthy cells in mitosis. Significant side effects are possible due to toxic levels, so therapeutic levels must remain stable. Chemotherapy extravasation, the accidental infiltration of the medication into the surrounding tissue, may cause tissue necrosis. So nurses require special training to administer chemotherapy per hospital policy. Last up, we have the anticoagulant heparin. This drug can be dangerous at high doses and should be monitored with blood testing and assessments for bleeding. PTT levels should be trended regularly, and early signs and symptoms of either explicit or hidden bleeding, such as tachycardia and fatigue, must be recognized swiftly.
Finally, patient education is crucial in medication safety for achieving positive patient outcomes. Make the regimen as simple as possible for each patient by speaking to the provider and advocating for drug combinations to reduce the administration frequency.
Then, communicate with the patient and ensure that they understand the key information about their medications, including the name, proper dose, frequency, and action. Explaining why the medication is beneficial will educate the patient about taking their medications as directed.
Thanks for watching!